Hi, this is my partner John. This is my
Hi,
partner.
lovely to meet you.
Nice to meet you.
Can't believe it's almost 5 years
I
now.
know, it's been a while.
It has been a while. Well, congratulations.
Thank you.
Very exciting. Now, before we get started, I've got a first year student working with me today.
Okay.
If you're happy to have her involved, that's fine.
Yeah, that's fine. That's fine.
Anything you want in private, just let me know. Give me a phone call. Just let me know.
Okay.
Well, come and follow me. Let's get started. Okay, so I'm sure you remember the drill from last time. This is a very boring visit. Lots of paperwork to get through. So before we do start, have you got any specific questions or concerns that we can discuss?
Well, this may sound a bit silly, but I've just been feeling really anxious, I guess, just concerned about this pregnancy. I need some reassurance. I need to know what we can do, what tests we can do, just to make sure that my baby's okay.
She's been driving me crazy. She's really worried.
It's very normal to be anxious and concerned at this part of pregnancy. What was the date of your last period? I'll just work out the gestation.
The 19th of Feb.
19th of Feb. Okay, that makes you 8 weeks pregnant. Again, very early on, so it's perfectly normal to be anxious.
Just that it's been 5 years since my last pregnancy, so it's all just...
Exactly, perfectly normal. We do lots of assessments and monitoring all the way through pregnancy to check that both you and the baby are well. Talking about tests, what we do at the beginning of pregnancy is we can do some screening for chromosomal abnormalities.
Okay.
It's optional. It's a combination of 2 tests. We have a blood test which we can do from 9 to 13 weeks plus 6 days, so before 14 weeks. This goes with a scan which measures the little fluid-filled space at the back of your baby's neck and the diameters. If you miss that first blood test, it can be done again. It's called a maternal serum screening test, MSS1 or MSS2 if you do it later. If you do it later, it can be done at 14 to 20 weeks. It's all optional. What it does is it combines these results with factors like your age, ethnicity, smoking status, BMI, and it produces a risk. So it won't tell you yes, no. It will tell you of an increased risk or a low risk.
So when you say age, does it mean she's high risk because she's old?
I mean, I'm
not
old.
She's not old.
36 is pretty old to be having a baby.
It is something that we're concerned about.
It is common for women to be waiting a little bit later to have children now, just the way that careers and families are working out. You're not old. Literature does show that with increased age there is an increased risk. Again,
so what happens if...
Again, we're talking risk. We're not saying there's a high chance, we're just saying a higher risk than perhaps a woman who is 20, it's true. But that does not mean that you were going to have a child with chromosomal abnormalities.
So what happens if I did have this MSS1 and there was an increased risk? What happens then?
If there is an increased risk, we can wait and see. It's completely your choice. There are 2 diagnostic tests we can have done. These will tell you, yes, there is a slight abnormality. For example, they pick up things like Down syndrome, Edwards syndrome.
Can we take this home?
Yes, that's for you. Where there's an extra chromosome in the cell which can cause some defects. They can be very, very minor, or they can be more severe. Are you happy to explain what these tests do?
Yeah,
the amniocentesis and the coronary release sampling.
Yeah. So live sampling are both performed with an ultrasound to guide the needle through the abdomen to take some cells of the amniotic fluid or the placenta. Now this won't touch the baby at all. So we want to just get some cells and to see the DNA of the baby. This will help us give an actual diagnosis of if anything is wrong.
So like the DNA from the baby is like in the water. You don't like put the needle in the baby.
We don't poke the needle. We don't poke the baby at all. So there's cells in the amniotic fluid and then that's from the baby as well. So that can give us the baby's DNA.
And we can see if they have the extra chromosome, or if, and everything's...
That's just how you can sort of tell me yes,
how we can examine the
okay.
cells and it will say yes or no. And we can take it from there. If the whole pathway, it's your choice. You can choose how far, which test you have done.
And that's only if it comes back as a high risk, It's
and even if it comes back as a high risk, you can ignore it. Some babies come back high risk and they're not, they're perfectly normal.
So, I mean, you're poking a needle in. Like, can the baby miscarry? What?
Yes, there is a low chance, 1%.
Very low.
Okay.
1% for amniocentesis and
Okay.
1 to 3% for chorionic
Okay.
villi sampling. But recent literature shows that there is an actual lesser risk than what I've just told you,
Okay.
because we're just getting better at doing these tests.
Part of it's a skill of
Yeah.
the doctors that do the test. So
But no, don't
It's-
stress about
yeah.
it.
don't worry
But
about it. It's
we-
nothing
yeah.
to think about now. It's very far off. It's completely
Yeah.
optional, like you said.
It should be 3 days. You didn't have problems with Gertrude or anything, eh?
No, I mean Gertrude was fine. I was a lot younger, as you said before, but
Mm.
I had a normal pregnancy.
You're not 15, my dear. You're
He
fine.
keeps telling me I'm old.
You behave. Okay, so carrying on in pregnancy, there's lots of just assessments and monitoring we do.
Okay.
So in a few weeks, we can listen to baby's heart rate after 11 weeks. So we
Oh,
count that.
so we
and
can't
listen.
do that today?
No, I'm afraid it's all very
Oh.
boring today.
Oh.
And what's the normal range of a baby's heart rate?
It's 110 to 160 beats per minute.
Very good.
Okay.
And we also measure your fundal height. Do you remember having that done when we have a feel of your tummy? And we'll get the tape measure and go from the
Yeah.
top of your bump down to your pubic bone.
Remember that.
And we plot that on a special customised chart just for you that might have come out since you've had Gertie.
Yeah,
For the last 5
I don't remember
years?
anything like that.
It's got lots of factors about you, your BMI,
Okay.
ethnicity, and it plots a sort of graph which estimates what the normal curve of growth should be for your baby. If this drops or it's too high, too low, we can send you for scans. It's a nice way to just monitor your baby's okay and growing as it should be. And when I'm feeling your tummy, you can also feel the fluid around baby and
Okay.
check that's normal.
So there was something that you said before, like that scan that you talked about, the
Nuchal translucency.
yeah, that's
goes
the
with
one.
the blood test.
That's the one where I find out if it's a girl. Isn't
It's a
it?
boy.
That's the anatomy scan. Anna, would you like to explain the anatomy scan?
Yep, sure. The anatomy scan is something we recommend you to do at 20 weeks. And it's just a scan to see how baby is growing and the well-being of your baby.
Okay.
And through that scan, we're able to see the physical abnormalities. So if baby's got 5 toes and 5
okay.
fingers.
And all the organs developments and things
Yeah.
like that.
Okay.
So
That's
that's the one we found out it's a
girl.
boy. A
You
boy.
can find
Okay.
out the gender, possibly, if baby is in a willing position to show you
Oh,
what's necessary.
He will. John Jr. He'll be.
We shall
He'll be
see.
showing.
Okay.
But if there are
But
anything
mainly that one's testing babies okay as well.
Yeah.
20
Yeah,
weeks.
again,
Okay.
we're
And 12
checking
more weeks.
all the organs are growing as they should be, all developed normally. And again, if there's anything picked up then, we can already put a plan into place. And if anything, we can even start administering things.
Okay.
That, you know, we'll talk about it when it comes. Everything
Yeah.
should be normal. It's just
So
a check.
we don't need to worry about that stuff now. It's just
Nope.
okay.
It's just something to
Alright.
think about for later.
Okay, that's good.
And of course, you can start monitoring your baby is okay
Okay.
when you're a bit further along. Do you remember when you started feeling baby move? About 20
Yeah,
weeks?
yeah, it was. It was about halfway through.
You might actually feel it a bit earlier this time,
Okay.
maybe 16 to 18 weeks, but don't panic if it's not that early.
Okay, will I feel it too?
Probably don't feel the initial ones, they'll feel like a little fluttering. When they get more strong and baby's got little fists and
Okay. Cool.
stronger legs, you will. And we used to say, look out for 10 plus movements a day, but new literature is saying that it's more important to know your baby's pattern of movement. So a baby might be quite quiet through the day, but then really active at night, typically when you're trying to sleep. And it's about working out what's normal for you and your baby.
So I don't need to count the movements as such.
No.
Just need to keep an eye and
But
know.
they're regular and they're
Okay.
strong and
Okay.
they're normal for how
It's all
the baby's
just
going.
okay. Just additional things,
Yeah.
isn't it? Just to make sure that
Because
baby's
if
okay.
things are well for you, then things should be well for baby.
Okay. Okay. That's all
So
right.
lots of precautions. So we've got lots of boring stuff to get through.
You better now?
So I've got some of your old notes here from your last one having Gertie.
Okay.
We'll start with those and here are some things to sign.
Okay.
Let's get started off with these.
Alright. Thank you.